Hi everyone, welcome back to the Pill to Know channel. Today we're talking about something we've all had, the common cold. It's annoying, it's uncomfortable, and it always seems to show up at the worst time. So what actually causes it? How can you tell it apart from the flu or COVID? And what can you do to feel better faster? Whether you're here to learn for yourself, a loved one, or just stay informed, you're in the right place. So grab a cup of tea, get comfortable, and let's break it all down. Simply, clearly, and with your health in mind. Before we jump in, here's a quick but important reminder. This video is for educational and entertainment purposes only. To stay unbiased, we'll use generic drug names throughout. And remember, if you have questions about your symptoms or treatment plan, always talk to your healthcare provider. Your health is unique, and your care should be too. What is the common cold? According to the CDC, the Centers for Disease Control and Prevention, the common cold is a mild upper respiratory illness, meaning it affects your nose and throat, and it usually clears up on its own in a short period of time. It's one of the most common illnesses worldwide. And while it's usually mild, it can definitely make you feel miserable while it lasts. Symptoms. Cold symptoms usually peak within 2 to 3 days after you start feeling sick. They can include sneezing, stuffy or runny nose, sore throat, cough, and sometimes a mild fever, though most people don't get one. At first, the mucus from your nose is clear. That's your body washing out the virus. After a couple of days, it might turn white, yellow, or even green. And that's totally normal. It doesn't mean you need antibiotics. Most people feel better in about 10 to 14 days, although the cough and stuffy nose can linger a bit longer. And here's a tricky part. Cold and flu symptoms can look very similar, so it's not always easy to tell the difference just by how you feel. Causes. There are over 200 different viruses that can cause a cold, but the most common culprit? Rhinoviruses. Other viruses like coronaviruses, the common ones, not COVID-19, adenoviruses, parainfluenza viruses, and enteroviruses can cause cold symptoms too. These viruses spread easily through the air when someone coughs or sneezes, or by touching contaminated surfaces, and then your face. Now it's important to note, while COVID-19, influenza, the flu, and RSV can all cause cold-like symptoms, they're different viruses that can lead to more serious illness. And here's something interesting. You can catch a cold any time of year. Some viruses are more active in winter, but others circulate during spring, summer, and fall. Prevention. So how can you protect yourself? The CDC recommends some simple but powerful habits. 1. Stay up to date on your vaccines, especially flu and COVID shots. 2. Practice good hygiene, wash your hands often, avoid touching your face, and cover your coughs and sneezes. 3. Improve indoor air quality. Use good ventilation or air purifiers if possible. 4. If you're sick, take precautions to avoid spreading it to others. 5. And if you're at risk for severe illness, see a healthcare provider early for testing and treatment. Treatment. Here's the truth. There's no cure for the common cold. It just has to run its course. And antibiotics? They won't help, since colds are caused by viruses, not bacteria. In fact, taking antibiotics when you don't need them can lead to side effects, like rashes, allergic reactions, diarrhea, or even antibiotic-resistant infections. So it's best to avoid them, unless your doctor says otherwise. How to feel better? Here are some simple things that do help. Get plenty of rest. Your body needs energy to fight off the virus. Drink lots of fluids, water, tea, or broth. Staying hydrated keeps mucus thin. Use a humidifier or vaporizer. Moist air can help ease congestion. Try saline nasal sprays or drops. These can help clear your nasal passages. Throat lozenges or cough drops can soothe sore throats, but avoid them in kids under 4. Honey is a great natural cough remedy, just not for children under 1 year old. Cough and cold medications. If your symptoms are really bothering you, some over-the-counter or prescription meds can help. Let's go over the main ones. 1. Pain and fever relief, analgesics and antipyretics. Examples: acetaminophen, NSAIDs such as ibuprofen and naproxen, or aspirin. They reduce fever and relieve pain. Tip: take NSAIDs or aspirin with food to avoid stomach upset. Warning: never give aspirin to children under 16 years old. If you live in the UK and 19 years old, if you live in US, it can cause Ray's syndrome. Avoid acetaminophen if you have liver disease. And be careful with NSAIDs if you have kidney or heart problems. 2. Antihistamines, H1 blockers. First generation, diphenhydramine, chlorpheniramine. These can make you drowsy. Second generation, loratadine, cetirizine, fexofenadine. These cause less drowsiness. These help with sneezing, runny nose, itchy or watery eyes. Side effects can include dry mouth, blurred vision, or urinary difficulty. Older adults should avoid first-generation antihistamines. They can cause grogginess and dizziness. And just a reminder, H2 antihistamines are for acid reflux, not colds. 3. Decongestants. Examples: phenylephrine, pseudoephedrine, oxymetazoline. They relieve nasal congestion and help you breathe easier. Possible side effects are headache, insomnia, or racing heartbeat. Precaution: avoid these if you have high blood pressure, diabetes, heart disease, glaucoma, or thyroid issues. And don't use nasal decongestant sprays for more than 2 to 3 days. You could get rebound congestion. Sometimes a combo of an antihistamine and a decongestant works better than either one alone. 4. Cough suppressants. Examples: dextromethorphan, benzonatate. These help calm your cough. Side effects can include nausea, dizziness, or drowsiness. And be careful, dextromethorphan can interact with certain antidepressants and Parkinson's medications. Always check with your doctor or pharmacist before using it. 5. Expectorants. Example: guaifenesin. This helps loosen mucus so your coughs are more productive. Side effects are usually mild, maybe a little dizziness or drowsiness. 6. Intranasal ipratropium bromide. This can help with runny noses and sneezing. Possible side effects include nasal dryness or nosebleeds. Avoid it if you have glaucoma or prostate enlargement. Smart tips for using OTC meds. Since many cough and cold medicines are available without a prescription, it's easy to accidentally overdo it. So keep these safety tips in mind. Always read the drug facts label before taking anything. Don't double up on the same active ingredient, especially acetaminophen, which can damage your liver if you take too much. Ask your pharmacist or doctor which product is right for you. Be extra cautious if you're pregnant or giving medicine to children. Read labels carefully and follow age-specific directions. And if you ever have side effects or want to report a reaction, visit FDA MedWatch online. When to seek medical care. Call your doctor or get medical help if you have trouble breathing or rapid breathing, signs of dehydration, a fever that lasts more than 4 days, symptoms that don't improve after 10 days, a cough or fever that gets better but then worsens again, or if a chronic condition like asthma or COPD starts acting up. If something feels severe or concerning, it's always best to get checked out. Most colds are mild and go away on their own, but they can still make you feel miserable. So take care of yourself, stay hydrated, get rest, and use the right remedies when needed. And remember, prevention is key. If you found this video helpful, don't forget to hit like and share it with someone who might need it. And make sure you subscribe to Pill2Know so you don't miss the next health breakdown. And to help grow this awesome, informed community, I'll leave all the sources and references in the description below. If you have any questions, drop them in the comments. I love hearing from you. Thanks for watching, and I'll see you next time. Let's stay healthy together with Pill2Know.